I'm KHU 11 Morning News anchor Kimberly Davis. Updated COVID booster shots adapted for the Omicron variant began rolling out at the beginning of the month for all Americans ages 12 and older. Dr. Anthony Fauci is urging Black Americans to get that booster ahead of the potential fall surge. We spoke with an infectious disease doctor with UT Physicians to find out why.
COVID is still pretty much a pandemic, and it's still pretty much with us here in town.
As of last week, data from the Department of Health shows there's still a 20% posterior rate in Houston, and COVID rates are about 3 times more than what we saw in the summer of 2020. According to Dr. Louise Ostrosky, the chief of infectious diseases at UT Physicians, there is a disparity in people contracting the disease and dying from it.
We really noticed that it was our minorities, or African American and Hispanic communities, that were taking on a disproportionate burden of cases and deaths.
Doctors are hoping if more communities of color get vaccinated, it will close the gaps in those outcomes. Currently, the demand for the updated vaccine is high, but still available.
Almost all the retail pharmacists and all the healthcare systems in town do have the vaccine and are able to accommodate anybody who wants it.
If you've already had COVID, Dr. Ostrosky doesn't recommend waiting to get the new vaccine. After 10 days from testing positive, you are eligible for a vaccine as long as you are at least 12 years old. For more on our series with UT Physicians, head over to khuu.com/healthmatters. For KHU 11, I'm Kimberly Davis.